Welcome. My name is Peter Strong, and I am a professional mindfulness therapist specializing in Buddhist psychotherapy, which of course focuses very much on changing the process that creates your emotional suffering, anxiety, depression, addiction, OCD, or PTSD, whatever it may be. The focus in this approach is helping you really change the way you relate to emotional habits like anxiety or depression. The problematic relationship is where that relationship is built on habitual reactive patterns of avoidance and aversion, patterns of turning away from our emotional suffering, turning away from our painful emotions, turning away from our anxiety, turning away from our negative thoughts and beliefs. Wherever there is aversion and avoidance, then the problem begins. The real problem is that these reactive patterns, these habits of avoidance and aversion, prevent the anxiety or depression or underlying emotional habits from changing and from healing. They cannot change if we continue to be reactive towards them, if we continue to avoid our emotions, if we continue to react with resistance and struggle and hatred towards our mind. That will simply make those emotional habits stronger. So if you'd like to talk to a therapist online who specializes in mindfulness psychology, and you'd like to talk to a psychologist online, then please go to my website and learn more about the mindfulness approach and how it can help you. And then email me to schedule a Skype therapy session. The mindfulness approach is very focused and very direct. It is quite different than conventional talk therapy. Talk therapy in general, talking about our emotions, may bring about a temporary relief from the symptoms. You may feel better, but that feeling doesn't last because we're not changing the underlying emotional habits and the patterns of avoidance and aversion that are feeding that emotional habit. So the same goes for medications as well. Medications have their place, but only as a short-term way of reducing the intensity of the emotional pain. Medications are not designed to change that underlying psychological process that causes your anxiety or depression or addiction. So if you'd like to schedule a session with me, please send me an email and I will be delighted to answer any questions you may have about Buddhist psychology and the mindfulness therapy approach and how it can help you overcome your anxiety or depression. From my experience, this approach of mindfulness is the most effective way of producing fast changes in emotional habits. And many of my clients see substantial improvements after the first 3 or 4 sessions. It's quite a different way of working with your mind. So I look forward to hearing from you. Thank you.